Mic check. 1, 2, 3. Mic check. Checking Dr. Freir's mic. Second mic check. Second mic check. 1, 2, 3.
Good afternoon and welcome to today's COVID-19 media briefing. As we move into a new phase of managing COVID-19 and the pandemic, LA County's COVID metrics are stable, as I'll share today, and I remain optimistic that the tools and resources we have will continue to provide essential protections against severe illness. As I talk through the upcoming changes that will begin to take effect as various emergency health orders lift, Public Health remains committed to providing accurate information, access to life-saving medicines, and implementation of safety measures that minimize the impact of COVID-19. Take the next slide. To begin today, I want to look at the trend lines for cases, hospitalizations, and deaths from the start of the pandemic in March 2020 through today. The green trend line shows the 7-day average of the number of cases reported daily, and it's measured using the vertical axis on the left. The average number of reported cases is 832 per day, a welcome decline from the 7-day average of 1,000 cases that we reported 2 weeks ago. With at-home testing, this trend line does not capture all cases in the county. However, it does help illustrate any large shifts in transmission. The orange trend line shows the 7-day average number of hospital admissions. This past week, there was an average of 88 admissions per day. This is a decline from the 109 admissions per day we reported during our last briefing 2 weeks ago. I'm grateful that hospital rates remain relatively stable. Although I do want to note, as you see here on the trend line, there have been other times during the pandemic when hospitalizations have been lower. This past September, we reported a 7-day average of 75 hospital admissions per day. And last spring, in mid-April, the 7-day average for hospital admissions was close to 20, reminding us of the cyclical nature of the pandemic and encouraging us to take sensible actions that can lower the number of individuals with severe COVID illness. The blue line on this slide shows the 7-day average number of deaths reported daily, and it's measured by the axis on the right. We're currently reporting an average of 12 deaths per day. This is a slight decline from the average of 15 deaths that we reported 2 weeks ago. To those who have lost a loved one to COVID-19, please accept my heartfelt sympathies during your difficult times. May their memories be a source of comfort and strength. We'll take the next slide. When looking at the hospitalization data, it's important to note that not everyone hospitalized with a positive COVID test is admitted to the hospital because they need care associated with their COVID infection. This slide provides the proportion by age of COVID-positive hospitalizations that meet the definition for COVID-associated illness, meaning that symptoms from COVID-19 are the reason that the person is hospitalized, rather than testing positive for COVID while admitted or in the hospital for a different reason. The blue line represents people ages 18 to 49, the green line is people ages 50 to 64, and the purple line represents people 65 and older. In January of 2023, the most recent month we have this data for, 60% of COVID hospitalizations, all COVID hospitalizations, were among people 65 and older. And of these hospitalizations, 55% were COVID associated, meaning COVID was the primary reason that these individuals were hospitalized. Statistically, we know that this age group is the most impacted by COVID-19. For the same month, about 20% of COVID hospitalizations were among people ages 50 to 60, and this was similar to the number of COVID hospitalizations for people 18 to 49. However, for the older age groups, 50 to 64, 50% of hospitalizations were COVID associated versus about 20% for those in the younger age group, 18 to 49. This helps explain why, on average, close to 50% of all those hospitalized who were positive for COVID infection were receiving care for COVID-related illness. The graph begins in August of 2022, and for all groups, the proportion of COVID-associated illness has increased since then, most significantly for people ages 50 to 64. In August, 41% of hospitalizations for this age group were COVID associated, and it's now 50%. For people 18 to 49, the proportion also increased from 15 to 20%. And for the oldest group, the proportion went from 52% to a high of 60% in December. Even with smaller numbers of hospitalizations, there's been an impact on both our overall mortality numbers and hospital capacity. Since the pandemic began, hospitals have needed to treat a certain number of people every day for a disease that didn't even exist 3 years ago. This has meant adding beds and reconfiguring space for many of our healthcare institutions. And the overall impact of COVID has, as reported by CDC, led to a 2-year decline in life expectancy from 78.8 years in 2019 to 76.1 years in 2021. This is the biggest 2-year decline in life expectancy seen in the United States since a time between 1921 and 1923. With an effective vaccine, it does remain important for residents to get their bivalent booster and talk to their provider about therapeutics right away if they test positive. These have both been shown to reduce the chance of severe illness and death associated with COVID. Next slide. Using the CDC's community levels framework, which looks at the case rate and 2 different hospitalization metrics, this week LA County remains in the low community level for the 8th week in a row, with a reported case rate of 57 new cases per 100,000 people. This is lower than the case rate of 69 per 100,000 that we reported in the last week of February. For the first hospitalization metric, the number of new COVID-19 admissions per 100,000 people, LA County is currently at 5.9. That's down from 7, which we reported 2 weeks ago. For the second hospital metric, the percentage of staffed inpatient beds occupied by COVID-19 patients, LA County is currently at 3.7%, just a tiny bit lower than it was 2 weeks ago. The continuing declines in hospitalization metrics is a positive sign. Next slide. Wastewater is an early alert metric for LA County, giving information about COVID-19 transmission in the community. We'll continue to routinely track COVID wastewater data even after emergency orders are lifted. On this slide, we have SARS-CoV-2 wastewater concentrations from September 11th of 2022 through February 25th of this year. As a reminder, we have 2 different graphs on this slide because we have made changes recently in order to utilize data from the growing wastewater scan or sewer coronavirus alert network collaborative. The new wastewater scan data includes samples from the Joint Water Pollution Control Plant, Hyperion, and Lancaster sewer sheds. The blue line is a weighted average for viral concentrations across 3 wastewater treatment plants, weighted by the population served by each plant. The most recent wastewater data we have here is from samples that were collected for the week that ended February 25th, since it also takes time for these samples to be analyzed and then reported to us. Looking at the main graph, it's clear that our current wastewater concentrations are substantially lower than what we saw during the peak of the most recent winter surge, and that they continue to slowly decline. This week, the concentration level is at 25% of the winter peak, placing LA County in low concern for wastewater concentrations, according to our county's early alert metrics. The bottom graph in the corner, that green line, shows the wastewater concentrations from the Tapia sewer shed. We're now presenting this data separately because it's analyzed by a different lab than the one used for the other 3 sewer sheds. For the Tapia sewer shed, we're seeing the same pattern, with concentrations substantially lower than the winter peak. Wastewater concentrations of SARS-CoV-2 virus give us information that our case trend lines don't, because they're able to track transmission that's not reported or captured through testing. While below our peak, you can see that the wastewater data is evidence that there's still significant COVID transmission. Next slide. Because our previous surges have been associated with new strains of the virus, it remains critically important that we continue to track variants. On this graph, you can see variants as a percentage of all specimens sequenced in LA County as of February 11th. Again, we have this 2 to 3 week lag in the lab data because of the time it takes to sequence the specimens. The circulating strains represented here are all descendants of Omicron, and we're not seeing any new variants or any rapid rise of any new strains. XBB.1.5, the orange section at the top of the bar, now accounts for 66% of sequenced specimens in LA County. This is, again, as of February 11th. This not unexpected increase from the weeks before. XBB.1.5, as you know, has been increasing across the country, and in other parts of the country, the increase was actually much more rapid. The CDC Nowcast uses models to estimate more recent data. The Nowcast data predicts that XBB.1.5 currently accounts for 90% of cases nationwide and 86% of cases in Region 9, which includes California. And although in the past dominance of a highly infectious strain has often been accompanied by surges in cases, hospitalizations, and deaths, here and in other parts of the United States, the rising dominance of XBB.1.5 does not appear to be correlated with more hospitalizations or more deaths. This likely reflects higher rates of immunity, along with the increased use of effective boosters and therapeutics. The strain XBB, that's that sliver of yellow on the bar, accounts for just 2% of sequenced specimens. Previously dominant, I remember our BQ.1.1, that purple bar, has dropped now to 17% of sequenced specimens. And finally, CH.1.1, that's the newest strain we're tracking, shown by that light blue bar, remains at just over 1% of sequenced specimens. With the data confirming that we're not seeing any newly emerging strains that are rapidly outcompeting other strains, we can trust that our tools and common sense protection measures can continue to minimize the impact of COVID-19. Next slide. We continue to stress the importance of vaccinations and the bivalent booster because our local experience shows how much of a difference vaccines make. On this slide, we've updated the hospitalization and death rates over the past 30 days for LA County residents who are unvaccinated compared to residents who are vaccinated without the updated bivalent booster, and residents who are vaccinated with the updated booster. This data can help us understand differences in hospitalization and death rates associated with vaccination coverage. The yellow graph is hospitalization rates per 100,000 people, and the blue graph is death rates per 100,000 people. Hospitalization rates as of the 30-day period that ended February 21st were nearly 5 times higher for people who were unvaccinated compared to people who were vaccinated with the updated bivalent booster, showing evidence for the continued positive impact of this vaccine even with the new strain of XBB.1.5. Vaccine protection continues to be evident even for people who were vaccinated against COVID-19 but haven't received the bivalent booster. They were over 3 times less likely to be hospitalized compared to people who were unvaccinated, and 1.5 times, however, more likely to be hospitalized compared to those who had the updated booster. It's sobering to look at these same comparisons for death rates for the 30-day period that ended February 14th. People who were unvaccinated had death rates that were nearly 4 times greater than people who were vaccinated without the updated bivalent booster. And for people who were vaccinated without the updated booster, the rate of death was nearly 2 times higher than for people who had received the updated bivalent booster. Unvaccinated individuals were over 6 times more likely to die than those who had received the bivalent booster. This week marks 6 months since the bivalent booster first became available, and these numbers demonstrate how the vaccine continues to work very well. The bivalent booster, as everyone knows, is available for everyone 6 months and older, and given the continued compelling information on booster effectiveness, even in times where transmission is lower, it still makes sense that those who have not yet received the bivalent booster, especially if they're in a higher risk group, get that booster dose as soon as possible. Next slide. In March of 2020, across the country, emergency orders were put into place at local, state, and federal levels to respond to COVID-19 and the resulting global pandemic. These orders recognize the serious threats posed by the new virus, and they were essential for allowing, among other actions, quick responses, rapid access to resources, and flexibility to reach as many people as possible with information, essential services, and vaccines. While it remains critical to continue to control the spread of COVID-19 in our homes, workplaces, and communities, we no longer need to rely on emergency orders to ensure we have and can use life-saving tools and mitigation strategies. Investments made to date have resulted in robust tracking methods, ample testing capacity, and effective vaccines and therapeutics. As long as there's an appropriate allocation of resources, we can continue to protect each other, those most vulnerable, and our healthcare system. As we adjust to the changes in policies and practices, public health remains focused on protecting and informing communities and the most vulnerable populations. When 2 federal public health emergency declarations end on May 11, 2023, a transition will begin to using traditional healthcare coverage to cover the costs of vaccines, tests, and therapeutics. While many will continue to pay nothing out of pocket for COVID vaccines, thanks to policies at the federal level and the state level, out-of-pocket expenses for certain treatments may change depending on an individual's healthcare coverage. Here in LA County, we have already started to work on plans that ensure that those who are uninsured and underinsured retain access to life-saving therapies and vaccines. The California COVID-19 state of emergency officially ended the last week of February, on the 28th. And on Friday, the California Department of Public Health issued changes to the state health officer orders that I'll review in a minute. Last week, the Board of Supervisors voted to lift the local LA County COVID-19 emergency declarations on March 31st, 2023. The ending of emergency declarations does not mean that all protections end. At all levels, many essential activities will continue because systems and networks have been built to ensure we can respond appropriately. In LA County, the health officer, Dr. Davis, retains non-emergency communicable disease control authority to issue future orders to protect the public's health from risks associated with COVID-19. Next slide. As I noted earlier, as we move forward, LA County is committed to continued access for residents to needed resources, including vaccines, COVID-19 testing, therapeutics, and telehealth services. Monitoring LA County early alert signals, including observing wastewater and new variant trends, tracking case clusters in schools, skilled nursing facilities, and work sites, and examining emergency department visit metrics will continue in addition to COVID surveillance activities in high-risk settings. Our plans also include maintaining response capacity to address any concerning trends and to be able to keep residents and businesses informed with accurate information and recommendations for sensible actions. Next slide. Because we remain in the CDC designated low community level, LA County Public Health is able to align with the changes made on Friday in the state health officer orders, including the new non-emergency guidance for COVID-19 isolation and quarantine that goes into effect on March 13th. This means that starting on Monday, if a person tests positive for COVID-19, they no longer need to test negative to leave isolation after day 5, provided symptoms are no longer present or they're mild and improving, and they have not had a fever for 24 hours without the use of fever-reducing medication. While testing is not required, public health strongly recommends that an individual test negative for COVID-19 to end isolation before day 10. This would reduce the chances of infecting another person with COVID. If a person has a fever and/or symptoms, they should continue to isolate until it's been more than 24 hours since their fever resolves and their symptoms have improved. Infected persons should wear a well-fitting mask around others for the total 10 days, especially in indoor settings, unless they have 2 sequential negative tests at least 1 day apart. Another change we're making in LA County is to align with the CDPH exposure management guidance. For those individuals who have a known exposure to a person with a confirmed case of COVID, public health strongly recommends, but no longer requires, that the exposed person wears a well-fitting mask around others for a total of 10 days in indoor settings or when near those who are at high risk for severe illness. As a reminder, people who have had a COVID-19 exposure should consider testing as soon as possible, and then, if negative, test again within 3 to 5 days after the exposure. Next slide. As we remain in the low community level, LA County is aligned with the state on current masking guidance for the general public. While in the low community level, masking for the general public is based on individual preference. People who are elderly, immunocompromised, have underlying health conditions, or have many exposures should consider masking in indoor public spaces. Masking is also recommended for those who have regular or planned contact with someone who's vulnerable. Next slide. LA County will also align with the changes made by the state on vaccination requirements for workers at correctional, detention, and adult care facilities. This is effective April 3rd, 2023. So this does not go into effect for another 3 weeks. Workers at these sites will no longer be required by state or county orders in LA County to be vaccinated, defined as a primary series plus 1 booster against COVID-19. Please note that any business or facility can continue to require vaccinations for all or some of their workforce. The LA County Department of Public Health will continue to carefully monitor case clusters at these sites to assess the impact of these changes on COVID-19 transmission. Next slide. LA County will retain current vaccination and masking protections in healthcare settings with a few modifications. In LA County, masking will remain required for all healthcare workers providing patient care or working in patient care areas. In other facility locations, employees are not required to mask. Visitors and patients are no longer required to wear masks in healthcare facilities, although masks do remain strongly recommended. Vaccination coverage, that's the primary series and 1 booster, will continue to be required for all healthcare workers, except those employees that are assigned to 100% telework who are never present at healthcare facilities. Most healthcare workers are already required by federal law to be vaccinated for COVID-19. These requirements will be reviewed and reassessed by September of 2023 so that we can take into account any updated FDA and CDC guidance regarding the timing of COVID vaccines and current risks associated with COVID infection. Next slide. In order to carefully track the impact of COVID-19, public health will also continue to require reporting of COVID case clusters and outbreaks at work sites, schools, and healthcare facilities. As you can see on this slide, which we've updated and shared regularly, this information allows us to better understand patterns of transmission and guide the use of safety precautions. Reports from these sites also facilitate early and effective intervention by the DPH outbreak investigators. We thank everyone at these sites for all their efforts to reduce the risk of transmission. Next slide. As we move forward, I share with many others the goal of keeping each other safe and healthy by making sure that critical resources remain available. Because we now know so much more about COVID-19, how it spreads, who's most vulnerable, and how we can prevent severe illness, which can also help decrease the risk for long COVID, it remains important to work together to keep transmission low. As a reminder, please ensure that you're up to date on your COVID-19 vaccines and boosters. To put simply, if you haven't had a COVID vaccine in the past 6 months, you're likely not to have had the bivalent booster, and you're probably eligible to receive it. This booster, specifically formulated for Omicron strains, is approved for ages 6 months and older. Vaccines remain free, and they're available in hundreds and hundreds of places across the county. It's a good idea to continue to make use of at-home tests because knowing about an infection can prevent you from inadvertently infecting others. And it also allows you to know about an infection as soon as possible so you can access therapeutics. You can still access free tests at covidtests.gov, and insurance plans are still required to cover 8 tests per month per member. Public Health distributes free test kits at dozens of sites across the county. The importance of testing is twofold. Knowing about the infection prevents you from inadvertently infecting others, and as I noted, it also, once you know about an infection, you can talk to a provider and access therapeutics if appropriate. I do encourage everyone to seek therapeutics immediately if they've had a positive COVID-19 test and they're experiencing symptoms. You can speak with your provider, visit a test to treat site, or use telehealth services to see if you're eligible. To find a site or to speak with a telehealth provider, please call us at 1-833-540-0473, 7 days a week from 8 a.m. in the morning till 8:30 at night. And last, a high-quality, well-fitting mask continues to be an excellent tool to prevent the spread of COVID-19. Many studies have shown that a well-fitting, high-filtration mask serves as an effective physical barrier to spreading droplets, and it provides protection to the wearer from viruses that are circulating. This is an easy way to protect yourself and others who are more vulnerable. I want to just note in closing that our next scheduled briefing will be 2 weeks from today on Thursday, March 23rd. And now happy to take your questions.
Hi. That was a lot. Thank you so much.
That was a lot.
That was a lot. So I just want to get everything straight here. So if I understood you correctly, the 10-day close contact mask mandate expires in LA County on March 13th.
Yes, it does. On Monday.
On Monday. Okay.
That's March 13th.
Okay. And we are aligning with the state when it comes to, if I go into a hospital, if I go into a dentist's office, I don't have to wear a mask anymore.
That's right. Visitors and patients no longer required to wear a mask by us. Many facilities will require visitors and patients to wear masks, and that is perfectly appropriate. But there's no longer an order for visitors and patients to wear masks.
Okay, but doctors are still,
all healthcare professionals, while they're taking care of patients or in patient care areas, are still required to wear a mask.
And vaccinated, which is stricter than the state.
The state is lifting, again, on April 3rd, the masking requirement at for healthcare providers, healthcare workers, and the vaccination requirement for healthcare workers. I want to note that almost all facilities in LA County are under federal requirements for healthcare workers to be vaccinated. So any facility that is accepting Medicaid and Medicare, Medicaid for us is Medi-Cal, is required by the federal government to, in fact, have a vaccinated workforce.
Okay.
So even if the state lifted, most of our facilities, healthcare workers would need to continue to be vaccinated.
Okay. So
and we're aligning. We're just keeping our current requirements in place. We're not changing them. Our current requirements are in place. They require that somebody's completed the primary series plus at least one booster. Exemptions are available. I mean, this went into effect years ago.
This is pre-pandemic. You're speaking about pre-pandemic.
Yes. No, I'm speaking about post-pandemic, but at the beginning of the pandemic, this was the requirement. And so everybody who's working now in a healthcare facility has met that requirement, or they have an exemption granted by the facility.
So you're saying that the state, when they said last Friday that on April 3rd we're lifting the vaccination requirement for healthcare workers, that is going against federal?
Well, let's not say it's going against. I mean, the way the state, the language that the state used is like at all those facilities that are required by federal law for the healthcare workers to be vaccinated, those healthcare workers need to continue to be vaccinated. And that's most of the healthcare facilities. So I don't think it's sort of going against. I think it's acknowledging that the state didn't feel like they needed to continue that requirement because the federal government has a requirement. We feel like it creates a lot of confusion at the healthcare facilities. We're just going to leave it as it is. We think everybody, including the federal government, will be reviewing the requirements for healthcare facilities when we have more information on what the sequencing is going to be on the vaccine schedules. If we're going to a once-a-year vaccine, it may look very similar to the requirements that we have for healthcare workers here around their flu vaccine, which is you get vaccinated or you have to wear a mask. But let's wait, see what the federal government is going to do, see what that guidance looks like, and then we'll make a change.
So 6 months will be in September.
Yeah,
that's when you say we will assess the
We'll
masks.
assess because we need the information from the federal government. I'm assuming that by September, CDC and FDA will have given us new guidance on vaccine schedules.
And masks.
And the masks are ours, our
Okay.
requirements. So that's not dependent on
So
the
why not
federal
align with the state when it comes to the masks for doctors, given how low the numbers are and given that before COVID entered our space that masks weren't required?
Right. It's a very good question. We've consulted with many of our partners. It feels like masks, when you still have a dangerous virus, that particularly in healthcare settings and in nursing homes, congregate care settings, you have very vulnerable people who have no option but to get services, that it's important to keep our masks on now. But we still continue to learn more. Everything we know right now says that these masks provide protection, and we really don't have lots of people, lots of healthcare providers saying they don't think they need to be wearing these masks.
We have a similar question from Jackie Fortier at KPCC. She says, what will the masking/vaccination requirements be for in-home care providers? She says the state said they're rolling back both requirements April 3rd. She was wondering about in-home care in LA County.
Yeah, I just want to note in-home care is also for vaccinations. It's also under the federal regulation that those employees, healthcare workers do need to in fact be vaccinated. We will keep ours in place as well, just as it's written now. We're not changing our vaccination requirements for healthcare workers.
Okay. Any more questions? Is there a particular study that you're looking at in terms of your decision to not align with the state about masks for doctors? Because you said we feel that, so.
Yeah, I mean, our evidence indicates that the highest risk, and this is the data, are for the most vulnerable residents in LA County. People who are sick with underlying health conditions and older tend to be the most vulnerable. They tend to be seeking care and needing care from healthcare providers more than other people. And we should just provide them with maximum protection. For them to get sick with COVID can in fact result in a devastating and severe illness.
And given where we are now in essentially 3 years into this, what is the message that you're sending by choosing to be masked every week? There's 6 people in the room right now.
Yeah, my message is, and I want to make this crystal clear. People who are wearing masks don't need to justify why they're wearing a mask. I think it's really inappropriate. I get this question all the time. You know, if I'm out somewhere and I'm wearing a mask, people are like, why are you wearing a mask? You don't have to wear a mask. And I feel like people shouldn't be coming at people wearing a mask. We could be wearing it for a lot of reasons. We could be sick. We could have people in our families who are very vulnerable. We could be under some treatment. We could be immunocompromised. We could just be an older person. We could just be somebody who wants to be super careful. Nobody in this room is required to wear a mask. We have no requirements in this building for people to have to wear a mask. So for everybody who's in this room, it's their choice to wear a mask. And I hope people understand that.
Jackie Fortier again. Sorry, she just wanted clarification. What about masks for in-home care?
I think that they're. I have to take a look, Jackie, and we'll get back to you. I'm pretty sure that because they're under the definition of healthcare workers, they're still required to mask when they're providing patient care or in patient care areas. I don't think we have carved them out as a different category of a healthcare worker.
Okay, thanks. That's it. We're all done. Thank you, Dr. Frey.
Thank you. Thanks, everyone. Have a good week.